Frequently asked questions about our thyroid hormone program. So what is thyroid replacement therapy? Thyroid replacement therapy basically is going to restore optimal hormonal levels, usually with T4, or what we prefer, a combination of T4 and T3 to treat what's called hypothyroidism or an underactive thyroid. The goal is to actually get your levels optimal and not normal. Many people are undertreated. Do I need thyroid meds if my TSH is normal? Most likely. So some people have what's called normal or subclinical TSH, but they still feel symptoms due to what's called a low free T3 and a low T4 and what's called a very poor T4 to T3 conversion. It's important to get a full thyroid panel and even in some cases a thyroid antibodies because many people suffer from what's called Hashimoto's disease or inflammatory or autoimmune thyroiditis. Now, what's the difference between T4 and T3? So T4, also known as thyroxine, is a storage hormone. Your T3, or triiodothyronine, is the active hormone that affects your metabolism, energy, your mood, and your weight. It really does help improve your symptoms, and most patients need both. How long does it take to feel better? Most of our patients feel improvements within 2 to 6 weeks. But optimal dosing and symptom relief can take a few months, and that's why you really should have frequent monitoring of your labs to make sure your dose is appropriate. Many people go underdosed. Now, a very common question is, will I need to be on thyroid medication forever? Now, if your thyroid gland is permanently underactive, like in autoimmune thyroiditis or Hashimoto's disease, yes. But some cases, like if a woman is in postpartum, if they have postpartum thyroiditis, or if you're deficient in nutrients, you really can come off the thyroid hormones once your lifestyle and nutrients are optimal. Now, some patients ask why they're still tired on their thyroid medication. Most of the time, it's due to the medication being underdosed, and a lot of times what happens is you don't get enough conversion of T4 to T3. And sometimes you could be dealing with other things like issues with your cortisol. You still could have a lot of nutrient deficiencies or insulin resistance. These things do take time, especially if you're having issues adjusting your lifestyle to meet the medicine where it's at. Another question is natural desiccated thyroid better than levothyroxine? Most patients feel better on a combination of T3 and T4, which is another name for desiccated thyroid. Some patients say they feel great on their T4 only, but it really is a personalized approach and individualized. But I will say that most people don't feel as good on T4 alone compared to T3 combined with T4. A great question that patients ask is, can thyroid meds help me lose weight? Absolutely, because they will support your metabolism. They're not weight loss drugs. However, they really do make a great difference in your weight loss journey, especially if you're having your nutrition optimized, you're on an excellent exercise regimen, and you really are controlling for insulin resistance, which is very common in many men and women. Another question we get is, do I need to take my thyroid medicine with food? Absolutely not. You need to take them on an empty stomach with water, ideally 30 to 60 minutes before you're going to eat or drink anything else, especially things that contain calcium and even black coffee. Now, another question we get is, do thyroid medications interact with other meds or supplements? Absolutely they do. Calcium, iron, antacids, estrogen, and even biotin can interfere with the absorption, especially on repeat lab work. You always want to space them out several hours apart. Now, this is why a lot of times patients don't feel as well, because they are taking things that can interact and make the thyroid not as effective. So this is why you need to go to a place that has your best interest in heart. For any personalized advice, reach out to us. Our goal is to help you look better, feel better, and perform better. Get started today.